counseling. And excuse me if my voice is very soft today. I'm getting over a cold, so just hoping that everyone else stayed happy and healthy over the holidays for Thanksgiving and enjoyed time with your family. That was well deserved. So today, this week, and this month, in fact, I was focusing on eating disorders. And this week, I am focusing on the last eating disorder that is noted in the DSM-5, which is bulimia. Now, the causes of bulimia, and I go into detail on my blog post, which will be posted on Thursday, about just teens and bulimia, but this is in general for all ages. And it shows that bulimia, the exact causes seem to be unknown. However, there's genetic factors. If there are primary relatives in the family that suffer from an eating disorder, oftentimes other family members will catch on and follow those same patterns. Emotional health obviously is a huge factor. You have to have good wellness emotionally, not just physically. And then societal expectations. So this also includes family pressures from social media and family, friends, anyone basically that is in your life that influences your decisions and your feelings about your body. Risk factors. I wanted to point these out, as some of us know some of the risk factors and others will surprise us. Bulimia is shown more to occur with women than with men, and age has a lot to do with it. It seems that eating disorders across the board, but specifically bulimia, tends to start up during the late teens and into early adulthood. Biology, as I said, is a risk factor, and the emotional issues, and including with that, people that struggle with low self-esteem, poor body image, anxiety disorders, traumatic events. A lot of time, as I've said in my previous videos, if you are suspicious of someone who's been abused, an eating disorder is usually a result after the abuse has occurred, kind of like a cry for help. And then sometimes, people in work environments and sports have to stay at a certain weight and look a certain way. Symptoms you'll see in people and your loved ones, or if you're struggling with an eating disorder yourself, just being aware of how do you view your body shape and your weight, or how does your loved one view that? Do you often, or does your loved one often fear gaining weight to where it is obsessive? Do you feel like you can't control your eating behaviors? Do you eat until you're uncomfortable or in pain, that you don't ever feel full, and you're forcing yourself to vomit or exercise too much to counteract the excessive calories that are going into your body, so you're trying not to gain weight. You're misusing laxatives, diuretics, or enemas as another form of using this counteractive for the excessive calories. And also, I want to note that there are several, if you look on the internet, and if you want to write any questions too about long-term effects, bulimia is one of the hardest on the body, in the sense of, because you're doing so many things, like the vomiting, you're going to get, your teeth are going to totally decay, you're going to have issues with your throat that are permanent, and other long-term, forever life factors that you should really consider, or tell your loved one about if you're trying to get them support. So just going on with when to see a doctor. If it's left untreated, then it's going to severely impact your health, as I just stated before. And helping a loved one with bulimia symptoms you can't force someone to seek professional help, but you can always encourage and be supportive. So no criticism, just always being supportive. Lastly, treatment. I'm a big believer of psychotherapy, obviously because that's what I do, but also it's such a huge part of being able to cope with life and developing skills and getting the support you need. And that way you're not just solely relying on medication, or oftentimes don't need medication. So in psychotherapy we use cognitive behavioral therapy, which identifies those irrational thoughts and finding evidence to point out that they're irrational, and developing new feelings towards positive thought patterns. Family-based therapy, which is also educating your family and discussing family dynamics and the roles of that have gone on since childhood. And interpersonal psychotherapy, which improves your communication and problem-solving skills. So you learn that in that type of therapy. And then medications, if it's severe enough, or your loved one is severe enough, then use an antidepressant, usually an SSRI, and that may reduce the symptoms of bulimia. But I encourage strongly to never just use medication. As I said, use psychotherapy approaches. You're also going to want to seek out nutrition education and healthy weight programs, having medically supervised weight loss programs, and supervised meaning somebody is coaching you through the process, so that in your weak times you're not feeling like you want to give up, because there are going to be hard times. Lastly, hospitalization. It's only if it's severe and serious and your health is dramatically peaked to serious risks where you have to be hospitalized. But there are day outpatient programs that you can seek out for your loved one or yourself. If you go on my website and on jenniferhillcounseling.com, and you click on the tab up top that says resources, and you scroll down, there will be resources for treatment programs that you can enroll in today to get help for you or your loved one. If you have any questions, contact me anytime. Email me through the website, jenniferhillcounseling.com, or you can comment on this video. And I hope that you guys all have a great week, and stay safe on the road with all the rain. Take care. See you next week.